Hi everyone, Dr. Nemechek here. I want to discuss how these new GLP-1 agonists, otherwise known as Ozempic, and the other drugs, are proving the point that inflammation is a major driver of most disease. So these GLP-1 inhibitors do a couple things. They make your stomach feel full quickly, they reduce hunger in the brain, they change how your insulin is regulated, and the effect of that is your appetite drops and people start losing weight. And they can lose 10-20% of their body weight. Now, this body fat they're losing, body fat makes a lot of inflammation, okay? And as I've said over and over, inflammation is what drives diabetes, heart attacks, kidney failure, many cancers, most neurological problems. And so when you reduce body fat a lot, you're really reducing inflammation. That's the main health issue, okay? Now, there's cosmetic issues, orthopedic issues, like less weight on a bad knee or something, and that's all fine too. But from a metabolic standpoint, you're reducing inflammation. And as you reduce that inflammatory stress, your body starts functioning normally. And so there are many now case reports coming out where a person's diabetes go in remission. People in near kidney failure have their kidney function restored. People in heart failure have their heart function restored. People with a variety of neurological problems are having some profound improvements. And these are all happening because we're reducing inflammation. And that is the whole premise of our protocol. The Nemechek protocol is driven to lower inflammation, okay? And when you do that, the organs of your body are able to start to recover in a miraculous way. We're going to see now the problem with Ozempic and these drugs. They're expensive. They probably are not being paid for often by the insurance companies and all that, and that's a big problem. Okay, the cost of drugs in America is ridiculous, but I'm not talking about that. What we're seeing is proof of this principle that a reduction in inflammation makes the body function. You know, I have videos here talking about how I can reduce inflammation and often get people off to maybe 3 blood pressure medicines. Okay, the body recovers. And what we're going to see, it's just too early to show, is they're going to have papers. I bet you'll see this in a year and a half, 2 years from now. They'll say, oh, people on Ozempic who lost, 20% of their body weight, their risk of breast cancer was dramatically reduced, or colon cancer dramatically reduced. They'll be starting to show that because most cancers are driven by inflammation. It just takes longer to show the change there. So keep your eye out for these drugs. Hopefully they'll get cheaper and we can start using them for things beyond just obesity and diabetes, and it's all about inflammation. And so you can just start today with our protocol: fish oil, olive oil, balance your gut with rifaximin. If you've got some ongoing major issue, maybe consider some vagus nerve stimulation, and you can be well on your way to recovery. That's it. Everybody have a great day. Bye.